All right, well, good afternoon, everybody. This is what environmental health professionals need to know about wells. It's being co-hosted with the National Environmental Health Association, and we're the Illinois State Water Survey and the Illinois Water Resources Center here at the University of Illinois. We manage the private well class, and we work with NEHA through our program, their partner with our funding through US EPA and the Rural Community Assistance Partnership. So about today's webinar, it's part of this national program I just mentioned. RCAP is the lead with a grant from the US EPA, and NEHA and ourselves are partners under that grant to provide resources and support not only for environmental health professionals but mostly for private well owners, and it's what allowed us to develop the private well class. We'll go through some of those things as we move forward. But this is a joint effort at the University of Illinois between the State Water Survey here and the Water Resources Center. I want to mention, my name is Steve Wilson. I'm a groundwater hydrologist at the Water Survey. We have with us Crystal Tate, who's a program manager for NEHA, and she'll be talking in a few minutes about partnerships and public health protection. We also have Katie Hollenbeck from the Water Resources Center, who will be fielding your questions, and this is a good time to mention that on your GoToWebinar panel, you have a spot there where you can ask questions. And if you asked a question when you signed up for the webinar, we've got that list separately, and we'll answer some of those questions today. But if you have a question that comes up while we're on the webinar today, you can post it in that question box, and if there's time at the end, we will get to those as well. Katie's going to keep track of those, and we'll pull those all up at the end after the other questions have been answered. And we also have two of our chemists that work at the State Water Survey, Dan Webb and Chuck Curtis, and they're available both. They've answered some of the questions you asked in advance, and they'll be available during the question and answer period at the end to answer other questions you might have. And I want to mention this is meant to be a 90-minute webinar. We've had over 400 people sign up for this today, and we received nearly 100 questions, which obviously we can't answer all of those, but we'll do our best. We'll probably be, we'll stay later if need be to get to some of the other questions if you're interested. Okay, so first is Crystal Tate from NEHA, and Crystal, I'll let you go.
Thank you, Steve. Hi, everyone. I'm Crystal Tate. I'm with the National Environmental Health Association. Thank you for joining us today. We are really excited to be partnering with Steve and his group, Jennifer and Katie, to grow environmental health knowledge around private drinking wells. I know I'm preaching to the choir here when I say that our end goal is always to protect public health. Private wells can present a unique challenge in protecting public health. They're not regulated at the federal level, and while there are some state regulations, they usually only cover newly constructed wells. The wells are on private property, and testing and test results may impact property values, and disease outcomes from contaminated wells, well, they might show up right away, like blue baby syndrome, or they may take years to show up. So convincing the communities to test their wells can be another issue. And now we have many studies coming out that are showing naturally occurring contaminants, very, very high levels, way higher than what has been deemed safe. We have new contaminants that are impacting our groundwater supply and private wells. And of course, we're having more severe weather events that affect well use and the water quality. So what can we as environmental health professionals do to protect public health? The issues around private water systems are a national problem, but at the same time very local. It's the communities where we live and the communities where we work. So local health departments, state health departments, environmental health professionals, we can't solve this problem on our own. We need to build partnerships. We need to reach out to the Steves and the programs like the private water class and cooperative extension programs that are doing great work with private wells and homeowners across the country. And partnerships such as this with Steve really helps build our technical understanding of what's going on with the wells, what are the concerns with the wells. And then once we have the science really solid and we know what we need to know around that, we've got to add in the community outreach. If our science is solid, how can we help the community members appreciate the need for testing and then make the recommended changes. And sometimes that's more challenging than anything else. There's a lot that can be done. That still needs to be done, and it doesn't happen overnight. Building programs and partnerships takes time, but it's always good to start with a solid understanding of what's involved. So thank you all for joining us and expanding your knowledge in the area of private wells. And I encourage all of you, if you haven't already, to sign up for it. Take the online private well course that's available on NEHA's e-learning site. It also comes with NEHA continuing education credits, and to sign up for the private well class newsletter so you can find out more about the terrific things that this group here with Steve Wilson is doing. I know they have some really exciting things in the pipeline that could greatly impact private well programs and private drinking water programs throughout the country. So thanks again, and I hope you enjoyed this webinar. Thanks, Steve. Back to you.
Hey, thank you, Crystal. All right. Today we're going to talk about some of the challenges and issues we face. So one thing about environmental health professionals, those of you that work, let's say, at the county level, it really depends on where you live and what state you're in or what your county or local rules are. What we've learned is that there's such variability. You know, a state like Illinois where I live, our county health departments inspect every well. It's all managed through our state Department of Public Health, whereas in some other states, they're very much locally ran. The counties really aren't involved at all. It's a local health district that's usually centered on a community. And so the rules may vary from one jurisdiction to another, even within a state. So there's a lot of challenges to that and a lot of variability that we're trying to deal with. And so what that lends to is one of the reasons working with NEHA is so important is we see such a wide variability in private well knowledge among EHPs. And that's just because of what's a priority or what is a focus in your area. And so we see some that have a lot of experience with private wells, and we see others that really don't even understand the basics of what it means to have a private well and what the risks are. So we're trying to encompass all that today. And so this is really just kind of a taste of what's there. As Crystal said, if you take the class on the e-learning side at NEHA, it'll give you a much better appreciation of especially all of those basics and much more in depth and that sort of thing. So today we're going to talk about those issues as well as well owner attitudes and why they're so hard to reach, a little bit about groundwater and wells, and then from my experience, one of the gaps we really have is between folks like me, I'm a groundwater hydrologist and a civil engineer, and health professionals that are looking just from or not just, but are looking at it from the protecting public health side versus the source water, groundwater, geology side, and how we really, the message is we really need to work together. So, and then a little bit at the end about the private well class program and what we have available that can help you with the well owners you deal with and serve, and then we'll get to our questions. So there are a lot of different issues, but it comes down to me to these three. It's all about public health protection and then source water protection and managing water quality. And everything else really falls into those issues. There are issues that make the news like drought, flooding, Flint, and they give us an opportunity in some cases to raise awareness of private well issues. But in general, those things come and go. And so, issues like calling things unregulated drinking water, private wells aren't regulated for a reason. And that's because many private well owners and most of the people who make those rules don't see a need, or is there funding or the ability to try to regulate every private well and private water supply. And so those things make the news sometimes, but they're really not where we should focus. And the real issues are basic ones: poor well construction, not understanding how to maintain a well, those sorts of things. And we have so many wells that have been installed prior to the current construction codes in your jurisdiction, assuming you have those tend to be the problem wells and the ones with the most problem. So our challenges get to that there's such differences. So trying to run, as Crystal mentioned, it's a national problem and we know there are national issues, but it really has to be managed locally. And that's one of the reasons we hope to work with most of you folks, because it's so different in every area. What is a private well? That's a question we got today, which I'll talk about at the end. whether wells are permitted or not, or whether logs are captured by the state or not. I mentioned the difference between New Jersey and Pennsylvania. New Jersey passed a law nearly 20 years ago that requires at every sale of property with a private well, the buyer and the seller have to agree that someone's going to pay, at the time it was $600, I don't know what it is today, to have someone from the state lab come out and take a water quality sample. And that's a very complete, quote, science-worthy sample that gives the well owner or the buyer and the seller all the details about any kind of contamination or any kind of water quality issues they might have with their well. And you contrast that with Pennsylvania, where they still have no well construction code and they still don't license drillers. And there's just not the political will there to do that. So anyone can install a well, whether they're licensed or not. They can use any kind of materials they want and install it any way they want. And though there's a lot of best practices out there, and what you see happening in Pennsylvania specifically is a lot of grassroots efforts to change that. So, for instance, in some counties in Pennsylvania, you can't drill a well unless you have passed the National Groundwater Association's Master Well Owner or Well Driller program. And that's one way that some counties have went about circumventing the fact that they don't have licensed drillers in their state. So, and then you add to that enforcing what rules they have. So I feel like we're pretty good in Illinois. We've had a law since 1968 that requires drillers to file logs with the state, but we still find cases where drillers don't file those logs, trying to save the well owner a little money, or states that don't have the resources to actually make sure that drillers are filing the logs they need. I know I went to a nearby state trying to do a project there, a research study, and I ended up giving up because in the area we were trying to work in, where we know there's arsenic, the state only had logs for maybe 1 in 10 or 1 in 15 wells. And having that information and knowing what aquifer the water was being withdrawn from was critical to our project. And so because they weren't enforcing that drillers file logs, even though they had a law that said they had to, there's a lot of data that's just not available. As I mentioned earlier, I said county here, but it should be any local health department, aren't necessarily adequately trained. And that's one of the things we've learned early on when we started the private well class. About 22% of the folks that have taken our evaluation at the end have been sanitarians, and many have said, well, I wish this was available when I started my job, or these resources, is there any other training available for me, because there just isn't a lot out there. So what that has led to is a more unorganized and local approach to how we support well owners around the country. And just like I know one of the questions we had from one of you who registered today was about when you look at how to disinfect a well, you see so many different things out there. Or what do you sample for? You see so many different recommendations out there, and it's not consistent, and there's not an approach that really kind of elevates the level of our knowledge as far as what private well owners are going through around the country. I mentioned this already, so what it comes down to is there's long-standing issues that aren't being addressed. I mean, before we deal with pharmaceuticals and personal care products and some of the testing that we can do today on the latest and greatest chemical that's out there, we still don't have a handle on wells that are improperly constructed and how we abandon those wells and get new wells if they need to be, or even abandon wells even though there's been a new well drilled. There are millions and millions of abandoned wells out there that are not only a public health or safety hazard, but also a source water hazard to the aquifer. And then combined with that is really a lack of well owner knowledge and education. Fully close to 75% of well owners around the country have never tested their well. And that's a huge issue when they have no idea what their water quality might be. And in many cases, their well water may be just fine, but not knowing and not addressing those issues is really where and that's kind of on us as stakeholders working with private well owners. It's our job to get that message out. That's hopefully what we're trying to do here. I guess going into the well owner attitudes arena, if you will, well owners come from every social, economic, and educational class. And what I mean by that is in very poor areas, very wealthy areas, education levels. You have people who grew up on a farm and lived there their whole life, and they've always drank that well water, and their grandpa lived to be 95, so they're assured, they assume they're well safe. We had a professor here at the University of Illinois, and this is a small community, about 120,000 people, and it's mostly rural outside of it, who came here from New York. He had his property he bought out in the country and lived there for several months before he realized he really had no idea how to take care of his well, and contacted us. So there's just a lot of variability, and what that does is it makes it very difficult on how to tailor a program or structure your program such that you're reaching out to the right people. When you have that wide variability, it's really every demographic of society that we have. So I grew up in a really rural area. I graduated in a class of 19, a small rural community in central Illinois. We also have many wells in Cook County, which is Chicago proper, and the near suburbs for Chicago. There are 11 collar counties around Cook County that all are urban because it's such a big metroplex or whatever. Cook County itself also has thousands of private wells. And that happens because of municipal boundaries and things like that. But you'd be really surprised. So Barb Lukonen and several others did this study where they sent out 2,700 surveys to 2 counties each in Wisconsin, Michigan, and Minnesota. And they were able to get 1,733 responses back, which is pretty good. It was really about well owner attitudes, and it's really valuable information. We look at this as really kind of the best example of what we know about well owner attitudes and why they do or don't drink their water. One of the things they did was gave folks a list of about 20 different options, and the top 10 are listed here, on why they haven't tested their well. And you can see here clearly half of about 1,100 of the 1,700 had never tested their water. And you can see here half of those folks said, we've been drinking it for years. You can go down through this list here and see at the very bottom, number 10, 8% said they don't want to know. That's a shame, and it also gets to the whole issue of, why don't we go to the dentist when we should? Those sorts of things, because what are we going to do when we find out what's going on? So 2 of the main reasons were they don't know, and that, again, goes back to us. We're not getting out there and doing enough outreach and making that message clear that, it is important what's in your water, and you do need to know what's going on. And the other side of it is just an attitude that it's fine, or not wanting to know. And it's just also these attitudes are what make it hard for folks to reach. And, there's a lot of reasons. They just believe it's safe because it's groundwater. My dad believed our well was safe because it didn't have chemicals in it like cities put in their water. Even though we had an old dug well that was only 14 feet deep, when it rained it was muddy, all those sorts of things that make it clear our well was completely unsafe. My dad always felt it was a better choice than drinking city water that tastes like chlorine. So human nature, you can see here the list. A lot of folks just don't trust the government or trust what we have to say. And, there's many well owners who still believe if they go to their local health department to get help, the health department might be able to tell them they can't use their well anymore. And though there are a few local areas, I know there's a county in New York and a few places where that may be the case now. When the county I'm mentioning, when you sell a property, you have to get it tested, and if there's something wrong with it, you have to remediate it before it can be sold. But that's one county out of the thousands of counties we have in the country. So in general, what we tell folks is that they should go to their local health department. They're here to help you. They want to make sure that you're safe and your children are safe and that sort of thing. So that's the message that we put out there. A little bit about aquifers and wells, and this is going to be kind of a quick basic lesson on different types of wells. There are really 3 types of wells, and it's all based on geology. When you don't have a, quote, real aquifer, or like the well I grew up on, it was an old hand-dug well because my grandpa hand-dug it in 1933. He didn't, probably even no one used a drill rig back then, or at least anyone he dealt with. And so you found a spot in a ravine where water ran and you dug a well. And so that's what we had. And these days, if you put in a bored well, a properly constructed bored well, it's usually because it's a large diameter, 3 or 4 foot diameter. It's meant to be almost like a cistern. It collects water and holds it and creates a volume of water that will supply you for the day so that water can seep in slowly. and it's because there's no real aquifer that you can tap that, you can pump a lot of water out of. And so there are also drilled or driven wells in sand and gravel aquifers versus drilled wells in consolidated rock, bedrock, dolomite, sandstone, those granite, those sorts of things. So the interesting thing about our geology is that in some cases you may have more than one choice. You might have a sand and gravel aquifer or two sand and gravel aquifers that sit over bedrock, and the bedrock actually has a good supply of potable water as well. But you need to understand that in some cases there are no choices, and those folks are just out of luck, which it's no different than any other mineralogy or oil or those sorts of things. Some places you have it and some places you don't. But the important thing for you to understand is in your local area where you're working, what are those differences and what are your choices? And, I would point to your state geological survey or your state resource agency like a DNR. Those folks should have information and be able to help you with that. So a dug or bored well, I mentioned that. It's a large diameter well. It's usually, if it's bored, it's a casing, it's concrete tile. And you can see on this picture, the boring machine is dropping dirt right there. But underneath the rig, right underneath where those two guys are standing, you can see the hole. It's a 3-foot diameter hole. They'll bore that out to a certain depth, and then they'll fill that with vertical pieces of concrete tile, like the tile that run underneath a roadway or a field lane or something like that. And those 4-foot sections of tile typically are not cemented, but just set on top of each other, and the water can seep in from those seams. And even though this may be mostly clay or material that doesn't provide a lot of water to a well, there is a water table at some depth where the ground's completely saturated. Like here in Illinois, that's typically between 7 and 15 feet, and then below that water can seep in the well. And there may be a thin sand lens. When I say thin, I mean several inches that strings out to a certain distance away that also provides a pathway into the well. These are 3 different examples of dug and bored wells. The one on the upper left is an old hand dug well, and you can see there's many things wrong with this. It's covered with 2x10s or 2x8s with tin over top of that, and it's secured with some old concrete blocks. Snakes, rats, insects can all probably get in this well, fall in there. They fall in, then they're going to drown and be there. These posts look so worn because this is a pasture that has cattle in it, and those cattle rub against those posts. They use it as a scratching post. It's on a hillside, so water from up gradient can flow towards the well, and that's a cornfield right above it there. So you have, application of chemicals. You have livestock that are obviously close by. It's a shallow well, and so you have all those issues, and it would be really surprising if this well didn't show coliform or nitrate issues in it. The other 2 wells, the one on the right is also as a bored well, and you can see they put the concrete tile all the way up to the surface and put a big concrete lid on top of it. So the well pump and everything, wiring, all that stuff is down inside, and it likely has a hole in the side of that at several feet below land surface where the piping and electricity and everything's running to the house. And the well on the bottom left is the same type of well, except that the upper 10 feet is only the 6-inch casing. That way it's a better construction method, or considered a little safer, in that the upper 10 feet where the 6-inch pipe is all filled with clay material to help prevent any surface infiltration near the well. So you can't really judge just by looking at a well, at least in the bottom left well's case, what type of well you might have. And these are 2 examples of the one on the left here is where the concrete casing comes to the surface. And you can see, if you look at the diagram, there's fine textured material for most of the land surface in this area. But then down at depth, there's these small sand lenses, which those creases in the concrete tile allow water to seep in. And on the diagram on the right, they put a concrete pad down at 10 feet, says 10 feet minimum, and then ran a 6-inch casing up to the surface. And in this case, it's more like a traditional drilled well with a pitless adapter, where water is running to the pressure tank in the house, and the wiring comes to the surface. So these are considered proper construction, at least in Illinois, for a large diameter well. And again, the reason you have this large diameter 3 or 4 foot casing is because water seeps in so slowly that you need to create a volume of water that can seep in during the evening or during the night, so that in the morning when everyone's taking showers and you're using a lot of water, your well doesn't go dry. But if you pump this very hard, in a lot of cases, these wells wouldn't be able to maintain a lot of pumpage over a long period of time. You can contrast that with a sand and gravel well. This is a well screen, and it's woven stainless steel, and those slots that are between the casing, or between each ring of stainless steel, are sized based on the geology and the sand grain size in the aquifer that you're putting your well in. So water can seep through and sand can't, is the bottom line. Even if the screen is stainless steel, the actual casing above that may or may not be. It could be PVC. And again, the size depends on the size of the well, depends on how much water you need, and the size of the screen depends on the size of the sand grains. And so what you typically do is, let's say this is a 60-foot well, there's a screen at the bottom 4 or 5 feet. And what that means then is that all the water's coming in from the screen. It's solid pipe above that. So you have 60 feet or 56 feet, if it's a 4-foot screen, of protection where the water has to come in down in the sand and gravel that's at depth. This is just an Illinois well log showing sand and gravel. In this case, the water, there's 41 feet of sand. So water's coming in from 4 feet below land surface. Well, water's coming in from 41 to 45 feet where the screen is. But the aquifer is all the way up to 4 feet below land surface. So this would be considered a pretty vulnerable aquifer because there's only 4 feet of material over the aquifer. Anything from the surface that infiltrates in can get to the aquifer. Now the advantage is that even if that's the case, the water has to travel through nearly 40 feet of sand, which acts as a filter before it can actually get into the well. And so that's why where your well screen is matters so much, because it determines the depth that the water is entering the well. Having that much sand typically means, as long as it's saturated, that it's a very good water supply. So you can see number 17 here, static level is 3 feet below the casing. And when pumping it at 50 gallons a minute for 3 hours, the pumping level was still 3 feet below the casing. So they pumped it at 50 gallons a minute and they had no drawdown. And that, that's indicative of a very high quality, a lot of water available type aquifer. If we contrast that with a bedrock well, so typically when you drill a bedrock well, not always, but typically you only use casing until you get into the rock. So in this example, if you can see that casing, it's cut away, but the casing stops 10 to 20 feet below the top of the bedrock, and below that it's just an open hole. The bedrock itself acts as a casing, and the reason you do that is to take advantage of those cracks. So you see those blue lines are meant to be bedrock fractures or cracks in the rock. And, bedrock's solid. So especially things like granite has no porosity. And so it's only the fractures where the water exists. And so when you drill a bedrock well, as a good example, or as an example, in this case, let's say that it's 30 feet to bedrock, and then you've added another 20 feet of casing to seep the well into the rock. So below that, it's all open hole. That well could be, so that's 50 feet of casing total. That well could be 100 feet deep. It could be 400 feet deep. But water can get in from 50 feet on down. And so that's where it matters. If this bedrock actually goes to the surface somewhere nearby, and there's a fracture that gets near the surface, the fractures themselves are almost like conduit or pipe, and water's flowing freely through those fractures and not through the actual bedrock itself. And so that's why a bedrock well can be influenced over much larger distances in some cases, because that water's traveling through those small spaces. And the porosity, which is a measure of the void space versus the total space, and like granite could just be 1% versus in the sand and gravel, the volume of water could be 30%. It's 30% airspace versus the space of the grains themselves. So it has to travel a lot further to get the same amount of water from a well. Here's a typical bedrock log. What's important here is understanding the geology and how deep the casing actually is. So in this case, they hit limestone at 187 feet. They went down to 260. At 257, they hit shale. And shale is is an aquitard. It's cemented clay, and so it doesn't really provide a way for water to move through it very fast. And so in this case, the water's coming from the limestone. Now there's a mistake on this log. It says on number 12 on the upper right-hand side, water from shale from 257 to 260. My guess would be that the driller gave someone in the office at their company all the information handwritten, and somebody typed this up. They're used to the bottom unit being where the aquifer is, so they put shale from 257 to 260 because that's the bottom unit. In reality, the water's coming from the limestone here, and if you look at the number 15, the casing and liner pipe, they used PVC from 1 foot down to 179, and then they used a 20-foot section of steel to seat it in the rock. So this well has casing down to 199 feet, and so water can get in the well from 199 to 257 or to 260. And so in this case, you have 199 feet of casing, which means it's fairly protected from the surface as long as it's been properly constructed and the annulus around the well bore has been sealed properly. Yeah, I guess that's really the most important information on here. You can see for number 17 here, the static level is 130 feet. That's the feet below land surface of the static water level. And when they pumped it at 25 gallons a minute for 2 hours, it dropped to 160. So it had 30 feet of drawdown, which is, not nothing. But most domestic wells or house wells aren't going to be pumped at 25 gallons a minute. They usually have a 5 to 10, and that's the most GPM pump in them, sometimes less. So it's very likely that this pump was set. I don't know if they put that on here or not. Yeah, I don't see it. But the pump was probably set well below 160. Oh, it's set at 160. Yeah, it's a 12-gallon per minute pump, number 5 on the left side. And so that gives you some idea of what's going on. Yeah. So as far as correcting poor well construction, I guess the bottom line is, though most states, I think there's really 2 states that don't have well construction code, and that's Pennsylvania and Alaska. I might be wrong, but I'm pretty sure that's the case. But even so, well construction code continues to evolve as we learn more. So the well construction codes from the 70s and all the wells drilled in the 70s probably don't match the well construction code today, and so those wells technically don't meet code today, but they've always been grandfathered in, which means we have a lot of wells with different types of construction, different types of casing. It's just like with all the lead issues today, they've eliminated what's considered lead-free. So if your pump has brass in it from prior to 2014, it could have much more lead available to it than after 2014, where we really have a lead-free designation that is actually lead-free. And that's just one example. But because of that, we have wells in pits. We have wells that are hand-dug that never met code. And I know, like in Illinois, you as a landowner are allowed to put in your own well if you do it yourself, although we've just changed the law recently that says you have to meet the well construction code in Illinois, but it used to not be that way. Anybody could put in their own well if they wanted to. And so going back to wells in pits, there's a lot of them out there still, and they're really a problem. Not only do they provide an opportunity for surface contamination, but they're also a safety hazard. With a big rainstorm, that pit may be flooded. If your well's not completely sealed, and that means no vent tube or anything, then it's likely that it's contaminated a well, that sort of thing. So here's just 2 examples, and I apologize. The one on the right is a goat that fell in an old hand-dug well. They actually tried to make this well a little better by putting a steel or a concrete casing for the upper 4 feet, and you can see the brick down there. It wasn't protected at the surface. It wasn't, and the goat fell in that one. The one on the left side, this is from the Washington State Department of Ecology, which is the primacy agency for well construction and drill and well code in Washington State. They have a blog where they put information out, which is really helpful because it really raises awareness. This is a case where I'm sure the person who lived here has stepped over that plywood, 1,000 times, and this time it broke and she fell in and killed this person, this well owner. But you can also see here there's a little piece of concrete over the hole, and you can see the broom up in the corner. Looks like old insulation has fallen down along this, probably a little well house, and so all that stuff can just fall in the well. Anytime you move the plywood there, even if it doesn't break, there's a lot of issues. So having this well sealed properly at the top and protected properly goes a long way towards making sure that it doesn't get contaminated. So what do you do with these wells? You should look at what your current construction code is, and if you're in one of those states that doesn't have well code, use somebody else's. One of the things that we've tried to do with this class is find what we think is the best information, and I'll get into that later, like when we talk about well disinfection. But bring it up to code. Make sure that if it's in a pit, you bring the pipe up to the surface, fill that in with clay, install a pitless if you need to, and then what we recommend to well owners in many cases is that you should go to your county or local health department for advice. And so, because that really should be the first line of defense, so to speak, for public health protection. You may know someone, a contractor or extension, but find out what the best approach is for your situation is what we recommend to well owners. And I wanted to share, just so you're aware, if you get questions from folks in your area, we're probably one of the folks sending them to you. I want to mention a little bit of abandoned wells. As I said, in Illinois it was 1968. Well logs weren't necessarily required and much later in some other areas, or as I said before, they don't enforce that the drillers actually file the logs. And so in many states, there are more wells that we don't know about than wells that we do. And for instance, in Nebraska, they didn't start requiring well logs till 1986. In New York, it was 2000. And in some states like Mississippi, if the well's under a certain size, you have to get a permit, but then you don't have to file a log. And so there's no evidence even that the well was actually drilled without a final log. And so you don't have the information you need, and all these wells are out there, and they're not only should they be properly abandoned and sealed, but if someone walks on your property and falls in an old well, that's what I try to tell well owners all the time. You're liable. Or it could be your own children. It could be you. You see this all the time. We showed that picture a minute ago. And, here's some more examples. Again, the two on the left are from Washington State. The guy on the bottom there fell 45 feet into the well and was very lucky that he's still alive. Livestock, anything can fall in these old wells, and the best thing to do is to seal them. The newspaper articles here on the left, or on the right, I'm sorry. 3 of those are all from Illinois, all in the same year. And the third one down is Jessica McClure. Any of you who are old enough to remember when that was covered live on CNN, it was 18 hours they worked to dig her out of a well, and it made national headlines. But most of the time, that's not what happens. And, Springfield's the bottom one here, Sangamon County, woman found dead. The girl 10 was in Buffalo Grove, which is a Chicago suburb, and Galesburg is on the west side of the state. These articles never made it past their local or regional paper, and so it happens a lot more than people realize, and it's a huge problem. So a little bit about groundwater and health gaps. So groundwater is complicated, as we've tried to show or mention here. There can be multiple aquifers. There are areas where there's no aquifer, and so those issues just aren't straightforward. For instance, you can't look at water quality data for even in a county and assume that all those can be lumped together and used to say, okay, this area has high arsenic. It may be one aquifer in that area has high arsenic, and maybe it only exists on a third of the county. It's much more complicated. Yeah, well, it's just not straightforward. There's also differences between a groundwater sample and a drinking water sample. I think the lead issues made that clear to a lot of people. If you take a sample from an outside spigot, it's before the pressure tank, it's just connected to the well, you let it run until you're getting a representative sample, you're getting groundwater, versus the water that's sitting in somebody's pipes, going through the pressure tank, maybe going through a filter or some other kind of filtration or RO or whatever. It's a much different water sample. And so if you have copper pipes versus lead pipes versus PVC, can make the water coming out of your kitchen tap much different. As far as dealing with well construction issues, again, there's a wide variability of what you might find, and it's really hard if you're just looking at the surface, what's going on, and having a well log is a really important issue. So our point is basically that it really takes professionals from both disciplines to do a good job in working with well owners in a given area. And, what we recommend is, your team needs to have both. It needs to have someone who can answer questions about geology and groundwater and, all the things about aquifers and types of wells, as well as the folks who can say, well, this is what having certain types of water quality mean. Here's why, having high iron can be a problem, statically, all those sorts of things. And you learn more. I talk about a high arsenic example. We did a study where we were looking at high arsenic where CDC wanted to come in and look at an area in the state. Well, it turns out there were 3 different aquifers in that area, and not everybody was on the same one. Plus, we had a large percentage of people who knew there was arsenic in the area, and they just didn't drink their water. So you can't really rely on water samples that we might collect to say this area has this sort of problem, and here's why there may be some health instance in this area. You really need to understand if people are actually drinking the water that has the high arsenic. I'm going to keep moving. So I just wanted to show this as an example. This is here in Illinois. We have a large aquifer that's sand and gravel. It's the A on this map, and it's considered, we've had 3 glaciations go through this area. So it's the Banner, the Glassford, and the Wisconsin episode glacier, or the pre-Illinoian, the Illinoisan, and the Wisconsin glaciations. And each time a glacier came through and then melted, it left sand and gravel and then clay. And then another glacier came in on top of it, did the same thing. And so even though the Muhammad Aquifer, which is the A member down here again, is a very large, substantial aquifer that covers 13 counties in Illinois, you have these smaller aquifers which are shown up here, like at the top between C1 and C2. There's a small aquifer, and at the bottom there, those sand and gravel aquifers are used a lot for a private well because they have plenty of water in that case. So it really matters understanding. And also, I almost forgot to mention the Pennsylvania bedrock here, Silurian dolomite. It also could be an aquifer, although in some parts it's high. It's kind of salty. It's high in chloride. But you have multiple aquifers. They may be totally unconnected, and they could have very varying water quality. And so having 2 wells, even 2 neighbors may have wells with very different water quality, and that might be a reason why. Okay, so what's the best thing to do? Develop a relationship with your scientific surveys if you have those, your GeoSurvey or State Water Survey, which there aren't a lot of those around the country, and then or your Groundwater Resource Agency and Extension. They can all provide, make your team, give you more wherewithal to do your job. And they have various names, DOE, DNR, DEQ. It just depends. But again, working locally, county and state level extension also. One, they have a good in with a lot of rural folks. And so sometimes that's really the issue when you're trying to do a project or work with well owners or to get them engaged. What you really want to find is the people that map aquifers and maintain logs and that collect, groundwater quality information, because that goes a long way at understanding naturally occurring contaminants and that sort of thing, and as well as geology and hydrology. And if you're unsure what to tell a person about a particular well type, those folks will have that information. So a little bit about the private well class. If you're not familiar with it, it's 10 lessons. You sign up on the website for free. It's all free. This is funded by US EPA. We do webinars like the one today, but many of those are for well owners, not for stakeholders as yourself. The 10 lessons cover everything from how water flows into your well and the hydrologic cycle all the way through. Here's issues you need to be concerned about if you're thinking about adding treatment, and everything in between. Why my pressure tank or why my pump cycles on and off, maintenance issues, source water protection, how to find information locally. We have one full lesson devoted just to finding local information, because we realize that it's better for well owners to go to folks locally and have them get help there than we can answer their questions from every corner of the United States. And so we provide a high-level, comprehensive class that teaches people about wells and maintenance and good stewardship, and then hopefully that'll lead them back to raising that bar, so to speak, and understanding what their issues might be and help them to ask better questions. That's kind of what our goal is. This is the front page. You click on Learn by Email. It takes you to a page where you can sign up. It just asks for your first name, your location, and your email address, and it sends you 1 lesson a week for 10 weeks. And it's a PDF currently that walks people through. They're about 8 pages each, and so it's a fair amount of material. And our goal here, one of the things we get all the time are people ask questions about a specific problem they have. Otherwise, they completely ignore their well. And our goal isn't to necessarily serve those folks, but to help people who really want to understand their well. If someone calls me and asks about treatment, I tell them it's in lesson 10, sign up for the class. And if it's something that's urgent, then obviously we deal with it. But otherwise, we want them to go through the lessons and understand what it means to be a well owner and how to be a better steward of their well and their aquifer for everybody else's sake too. With each lesson, there are other resources. We wrote this like we were talking to folks, and so it's written in that tone. Maybe that doesn't resonate with everyone, and so we provided a list of resources that you can click on. They're all publicly available that provide additional information in a different style, if you will. And so one of the biggest things we get in our evaluation is folks have said that they've used some of these other resources to find things out. Plus, we went through and vetted a lot of this material, so it's only things that we consider to be, well done, clear, or comprehensive on a particular topic. Like the first thing listed here under number 2 for groundwater well contamination is the Michigan Flowing Well Handbook. Michigan has so many flowing wells that many years ago they passed a law and said you have to cap them. They're losing over 28 million gallons a day of groundwater just flowing out of wells that, artesian head was above land surface. And so it's very comprehensive. It talks about how to seal a well, all the issues related to it, explains all that information. And, like here in Illinois, we have a couple areas where we might have some flowing wells, but they're very small locations as far as aerial extent. And so we just don't have the issues that Michigan does. But it's a place that someone in Illinois or anywhere else in the country could go to for a better comprehensive view of what it means to have one. In the end, what we're really trying to do is give well owners, like I said, a high level but comprehensive information and advice on why their well is important and why they need to understand how it works so that they can protect themselves from risk. To me, the goal is if we've helped people ask better questions to their state or their local health agency or resource agency, then we've done our jobs. And so that's what we try to do. As far as for EHPs, environmental health professionals and sanitarians, again, working with Crystal and NEHA, we do have a version of our classes on their website, which they provided quizzes for as well so that you can get CEs or CEUs if you're a sanitarian, and the Association of State Home Inspectors, I think that's the right acronym, they provide accreditation for home inspectors there, and NEHA's graciously opened up their site for them as well. Because, again, it's all about trying to get the information out there and raising that level of awareness. So we are hosting workshops around the country currently and through this next year that are for environmental health professionals. It's really 2 parts. I'll talk about that more in a minute. One is about how to do outreach to well owners based on the work that we've done, and we had a grant from CDC that allowed us to evaluate a lot of programs around the country and why they weren't successful. And also we developed an assessment tool. It's like a sanitary survey that helps someone can go out and use it with a well owner to evaluate their risk and vulnerability based on their construction, geology, and the site conditions. So we have a partners page, which is really meant for stakeholders working with well owners like yourselves. And we have a newsletter that goes out once a month, which Crystal mentioned. We do webinars basically every month. And we did one on August 30th about what well owners need to know about lead. Along with that, because it's such a, we get a lot of questions about it because of what's happened with Flynn and the public awareness outcry that's caused. We did this webinar and we worked with EPA and some other folks to provide those materials, and we created a lead page. It's privatewellclass.org/lead, and it takes people back to resources from CDC and EPA and all the information that's out there that can help a well owner understand what their issues might be if their home is older, if they have lead pipes, or if they have pipes that are copper and might have lead solder, that sort of thing. We put together these short videos. They're 3 to 5 minutes long. How does my well system work? Walks people through. What can I do when my well goes dry? We're working on one that's not completed on what to do after your well's been flooded. Those are common issues. And so we've tried to create resources that are beneficial. There's 16 of these short videos. We put one out about how does my pressure tank work, and what we've learned. We put that out this last January, and it's had, I want to say, over 25,000 hits already. And what that tells us is there isn't a lot of information available for well owners on how their pressure tank works. And so those sorts of things, they're meant to be a resource you can guide people to. There's 16 of those, as I mentioned. And we've also started creating podcasts. There's only 3 of the 10 lessons done, the first 3 that are listed there. And the other things are part of a radio show that we do with RFD Radio here in Illinois, which is ran through the Farm Bureau. But if you're into that, I know these podcasts have had over 1,000 downloads already. And we've had about 5,000 people take our class. So we hopefully are doing something right. And as far as partners go, there's a partners page. If you click on the resource library, you can get to that. It asks you to sign up for as an outreach partner. As you go down the page, each of our newsletters is listed there, and you can look at those if you want to sign up. And there's also promotional tools and things you can download. We hope everyone puts a link to our class on their website, to be honest. It's useful information for a well owner. We're already on 200 or 300 different county and state health department websites, as well as other stakeholders. So again, it's all free, and whenever we get a call from a well owner who's in your jurisdiction, we try to get them back to you for help. This is just the front page of our February newsletter when we launched the class on NEHA's website, and it's got every month there's either an article about some program that's going on, or a partner like a county that might be doing something unique that you can take advantage of, those sorts of things. And quickly, I want to mention that we're putting on these workshops I mentioned. They're 4 hours. We work with RCAP, the Rural Community Assistance Partnership. They are actually putting on these workshops in 24 states. About 12 of those have been done already. And there's a link on our webpage. You can go to the workshops page and see where those are going to be and when. In addition, we're going to put on 3, those dates listed below there, that are online as a webinar. It covers the same material. It's really 2 things. It's about best practices for how to work with well owners, and we cover put a little bit of that in here for the outreach on the attitudes from the study that was done up in Wisconsin, Minnesota, and Michigan. But it's mostly about some funding we had from CDC to evaluate about 100 other programs that do outreach to well owners and gather information about what they did, what was successful, what wasn't, and what we've learned from all that. And we've developed a model program for if you're starting from scratch, here's what we recommend, how you go about doing that. It includes a lot of partners and a lot of advertising, I can tell you that. So the other part of it is this assessment tool I mentioned. We've developed a 9-page assessment tool that's very similar to a sanitary survey, but it's just about a well and a private well owner and what might be going on at their property. It covers a lot of different vulnerabilities, where everything's located, where's their septic tank, what kind of well construction do they have, all those sorts of things. We run through a number of examples of different types of wells and how you would use that in the field to assess a well. So I'm going to move on to the questions, and I want to mention that we had about 100 questions that folks provided in advance when you registered for the webinar, and we'll try to answer a fair number of those, but we obviously can't answer all 100. And if you asked a question and we don't get to it, please email us, and we can try to deal with it after the fact and online or offline, because when you sign up, it doesn't track who asked what question. And so if we don't get to yours today, if you'll email us, we certainly will. And one of the things that we're building currently is an FAQ, per se. We're taking all the questions we've got from all of our webinars and from folks who called us or emailed us, and we're answering them all and putting them in a searchable database that'll be online probably around the 1st of this year. So again, if you have any questions on what's been covered today and didn't ask a question previously, or you have a different question, please feel free to put that in the question box, and Katie will track that, and we'll go over those at the end. And I just want to mention some of the folks that answered a lot of these questions that work with all of us here. We're really a team. There's about 7 of us that work on this all the time. Walt Kelly, who's the head of the groundwater section here, and Dan Webb, who's the head of our analytical lab, our public service lab, and Devin Mannix, who's also in our groundwater section at the Water Survey, and also Kurt Blakely and Kurt Abert from the State Geological Survey, who we work with, all helped answer some of the questions we have today. So if you guys that are muted want to unmute yourselves, I'll start going through these. So first of all, what's considered a private well? The best definition really is a well that's not regulated. So it's not considered a public water supply. And if you're familiar with those terms, the Safe Drinking Water Act really lists 3 types of public water supplies. There are community water supplies, which you get your water from a community that you live in. A non-community, a non-transient water supply, which provides water to the same 25 people, I believe, at least 60 days a year. It might be 180. or a transient water supply, which provides water to at least 25 people that could be different at least 60 days a year. And so a non-transient example might be a rest area, where there's more than 25 people using the water every day, but it's not the same people. The example of a non-transient might be a school or a daycare or a church daycare in the country or a factory that has its own water supply, where it's not a home, you're not in your house or whatever, but it's a business generally. Yeah, so that's the differences. And so, a small business that has 4 employees that's in the country is really a private well. But as far as, because it doesn't meet the definition of the Safe Drinking Water Act, but they don't live there, and they're not showering there, and they're not cooking there typically. And so for the part of our project that's funded through US EPA and by RCAP, what we're looking at and what we try to work with are private well owners that are domestic well owners. So it's a homeowner well, or in some cases you have a shared well, but it might be 3 homes that are using one well, and that's for their primary drinking water supply. So I hope that helps. So what do I test for? Well, there's 4 slides here, or maybe 5, and there's a lot of variability. We've run into cases where, for especially the transaction of a property, or a HUD loan, for instance, it says you have to use local rules. If there's a local jurisdiction that has its own rules, or state if they don't, or in absence of that, you should use this primary drinking water contaminants from EPA. Well, the third one there would cost about $4,000 to do all the same testing that a community does for their public water supply. And so typically what happens is in different jurisdictions, well owners are being told they have to sample for different things. And that's really a problem. It's what it amounts to is unequal protection for their health. One of the things that we're trying to deal with in that realm is trying to make that more consistent and share with everyone that, because one county or local health department says it's okay just to test for nitrate and coliform, and another one says you have to test for these 30 things, really we need to come to some equilibrium and some balance where we know everyone's being protected and we're sampling for enough things. And the best example that I have is a well owner who contacted us and wanted to know about how to get her state law changed because their county told them they only had to sample for coliform bacteria and nitrate. They sampled their well, the sale went through, she bought this house, and 6 months later had her well tested and found out she has 150 ppb of arsenic. Now she's mad because she feels like their county told them their well was safe, and it obviously isn't. And so trying to deal with that is, it's kind of a big gorilla around the country, so to speak. But we are trying to create a standardized list that we feel will do both those things as well as protect folks who may have older homes and there's lead or copper issues. And so let me go back. So what you sample for really is dependent on a lot of different things. And so what we recommend is that people do 3 things. One, they talk to their local health department and ask them for advice, especially if there's anything locally that might be a concern. The second is to look on their state or county county websites, not only the health department, but also their resource agencies, to see if there are any contaminants that might be identified in your state. And then third is we have a basic list that we think everyone should use. And that's our opinion, but we've ran this through a lot of different people, and we seem to have a fairly good consensus on what that is. And so first of all, it's you sample for coliform and nitrate annually, not because they're a health risk on their own necessarily, but because they indicate a pathway into your well. So if likely the most common things from surface contamination are going to be coliform or nitrate. And so by testing for those and you find those, it generally means that you have some sort of pathway into your well. Okay. As an example, Massachusetts DEP has this website. Why we tell people to go to their state website, you can type in your address and it'll tell you whether you need to sample for coliform or nitrate. For arsenic or uranium. Pretty helpful, and it just gives you an idea of what they think might be going on. And a number of states have not necessarily where you type in your address, but have information down to the county or local level on water quality issues that might exist. Here's a second example. This is Rhode Island. All the little circles on here are where there used to be orchards, and they used a lot of arsenic. There's a lot of arsenic in the soil in these areas, and so they would recommend if you're close to an old orchard, you sample for that. And the big splotch that's in the middle is actually beryllium. And it turns out before I had worked on this project nationally, I didn't even realize beryllium was a regulated contaminant, but it is. It has MCL, and it's a health risk. I think it's unique to a few areas in the country, and this happens to be one of them. And so, if you're in this area, you need to sample for beryllium to see if it might be over a health standard. And those are just two examples. I know Wisconsin has a website that's an interactive, GIS site that'll show water quality parameters. So does Washington State. They show a lot of actually water quality analyses from individual wells on their website. So it depends on where you live, but you should at least look and see if your state might have those things, and you can share that with well owners. But here's what we recommend: coliform nitrate annually, as I said, and the rest of this list really gives you an idea of the general water quality of your well, as well as if there's any issues that might be, you can determine if your water might be corrosive, and if you have, assuming most folks' homes are older than 2014, you have lead solder or you have brass or copper that might, be an issue. The other point of that is if you have, let's say that you're in an area that has low levels of arsenic, it's always between 3 and 10 in the area, and you sample your well and it's 8. 5 years from now, it should still be 8. Same with, if your turbidity or TDS change dramatically from 5 years ago, that generally indicates that something's changed in your well, and it makes it worth trying to investigate what's going on. Groundwater is fairly consistent as long as it's not disturbed. I have wells that have a network of monitoring wells that we've sampled since the 90s, and the arsenic's always, in this particular case, is always consistent, and it varies. In the same area, you can have arsenic that's barely detectable, or you can have it as much as 200 ppb, and the same wells indicate the same level of arsenic every time we sample. And regarding real estate transactions, I already brought that up, but I just want to reiterate that we've approached HUD and USDA about the issues related to their requirements for home transactions. And I don't know if we'll make any headway there, but we really feel there should be a consistent message across the country on what people should be sampling for, and not the variability that we're seeing today based on what some local entity may want. I think it needs to be similar as the MCLs. The arsenic MCL nationwide is 10 parts per billion. That was set by US EPA, and it's in the Safe Drinking Water Act. California chose to make it 5. They went to make it more strict. I think if that's the case, then great. But if there needs to be a standard that everyone's using and that we're protecting public health. Radioactive groundwater. Is groundwater radioactive? So depending on the geology of the region, I'm just going to read this. Groundwater can contain trace amounts of radioactive elements, radium, uranium, and radon. Yeah, radium is definitely the most common. There is a standard for it. Water softeners, looks like I didn't spell that right, and reverse osmosis can be effective at removing that. So yeah, it certainly can happen, and the best way to know is to test. Should private well owners test their well for radon? Well, so currently there's no standard for that, but I know I just bought my house 2 years ago, and we did a radon test, and whether even in homes that don't use private wells, you can have radon issues. So it comes from the decay of radium, and there's a lot of radium in the ground. So if you do have radium in your groundwater you've tested, then you certainly should consider testing for radon, because depending on the situation, it might be there. And Walt Kelly's listed here, I believe, treatment. You can remove radon, aeration, which in some cases, even if you have your water really smells bad, you can do things like aerate it first and vent off all of that gas before it comes into your home, and that will help your water as far as how it smells or what issues you might have. Or you can use a granular activated carbon filter. And if anybody, Dan or Chuck or anybody else, has any thoughts to add to any of these, please just jump in. So home test kits, Dan answered this question. How accurate are they? Well, it really depends on the tests. They're certainly better than they used to be, and some are fairly accurate, but it really does depend. And, the colorimetric ones, I'm colorblind, for instance, and so it's never been a great idea for me to use those in the field test kits that use a color. It depends on the lighting. I know we had problems if we were in using white light versus outside using direct sunlight, what shows up on that chart, those sorts of things. What I would recommend is that you use them as a screening tool, and Dan said this as well, but also if you're going to consider using these home kits or recommend them to a well owner, you should test them first yourself. And the best way to do that is to test them side by side with samples that are going to a lab and see how they relate and how accurate they might be. And, there's probably a lot of information on the web about how good some of those things are. It's like treatment devices. You need to make sure that whoever's giving you that advice doesn't have a stake in the game, and that what they're providing is an unbiased result that you can, make a good decision from.
Can I say something real quick, Steve?
Sure.
Hey, one thing on the test kits, be aware of the units they use. Like, for instance, nitrate, a lot of the standards are set around nitrogen, so it'll be nitrate as nitrogen, and you'll find some test kits they'll test for nitrate itself, and there's a big difference. It's 4.5 times difference, so make sure you know what units you're testing for and know how to do the conversion. Nitrate's not the only example, but it's typical. Nitrate and phosphate are the ones I'm thinking of right now. Most of the things you don't have that problem with, but also pay attention to parts per billion and parts per million, or micrograms per liter and milligrams per liter.
Yeah, one of the things we ask in our pre-tests when people take our class, we have a math question about converting from milligrams, micrograms, ppb, ppm, and about 3,000 of the 5,000 people have taken the pre-test. It's not required, and only 27% have got that question right, and that's really converting from 100 ppb to 0.1 ppm. We ask them to tell us what that answer is, and 3/4 get it wrong. And so that's why, even in our class, we recommend there's some websites out there where you can throw in your sample analysis and it'll give you a result. We tell people that's fine to look at for yourself first, but then we recommend you go to a local health department and have someone who's qualified look at your results and give you a qualified answer. Because you can't rely on, especially the units, not typing those in wrong, as Dan mentioned.
Thanks, Steve.
Yep. Are wells impacted by septic tank and leach field effluent? If so, what parameters should you test your well water for and how often? So they certainly can be, and it really, if your well's not sited properly or it's not constructed properly, or if it just happens to be a shallow well, the reality is that septic effluent is typically reaching the water table, and then as it percolates through the soil's remediating the bacteria and, doing its job, breaking things down. And so when you usually have septic contamination, it's because either you have a very shallow well that's maybe getting its water from the water table, like a border dug well, or you have some sort of breach. And we've seen all kinds of things. Even a well that was constructed and a tree was planted nearby, and it's a PVC well, they started getting bacteria contamination, and they couldn't figure out why. Well, it turned out a root had got around the PVC, and as that root grew over years and time, it eventually cracked the PVC. And so, along roots, there's a lot of bugs, and they chlorinated their well several times, and they kept having problems, and it ended up being that a root had basically cracked their well. So I guess to answer your question, it certainly can. What we see also with septic systems is that there's times where we do a septic webinar every July. Folks don't even know where their septic tank is. And, proper maintenance of your septic tank is a big factor in making sure that everything's working the way it should. And if they do maintain it and they pump it when they need to, then there's a lot less risk of problems. So well pit versus pitless. Someone asked about what's the difference and why does it matter. Pitless adapter was invented to replace well pits, plain and simple. And the reason you needed a pit is because above the frost line in the United States, if you didn't have a pit and you brought your pipe to the surface, your pipes would freeze in the winter. So you dug a pit and you ran your line 3 or 4 feet below land surface into the house so that you could keep your pipes from freezing. And the pitless adapter was developed to replace that. I've already mentioned the problem with well pits. There really shouldn't be any. And if you have one, our recommendation is always that they get a contractor to raise their pipe up to the surface or above the surface, put a proper cap on, and fill that in with clay. When they flood, they can be a risk if it's not completely sealed. And even if you think it's completely sealed, most well owners don't go out and check their seals every 3 or 4 years to make sure that the rubber hasn't corroded or dried out and is brittle. And so most well caps aren't as sealed as people think they are. Like I said, we recommend they bring them up to code if they can afford to. But having a well in a pit is really a bad idea. We've seen where tractors, people falling in them, I mean, all kinds of things as well. Just to show you, here's two examples. One is a pitless unit, which you can see the casing here where the pitless unit threads on. There's that pipe goes down to the pump. The water flows through this pitless and to the discharge line in the house, and this is below the frost line. So you might be at 2 feet or 5 feet, depending on how far north you are, or even further. And the other way that's done is with a pitless adapter, which pulls right out of the well. It's still the same well casing. You do have to put a hole in the side of the casing for your discharge line, but that's all sealed and welded. And the advantage here is that thing, it's usually on a swivel, and it snaps into place with O-rings, and it shows them on the one on the left, but even the one on the right, that whole thing pulls out, and that lift-out locking wedge pulls with it, and then you've got usually your pump's connected to another cable that you can pull the whole thing out with. And the contractor would need to be able to get through that to get to your pump, and so it's really a pretty handy device. And certainly here in Illinois, most wells that are drilled are installed with those pitless adapters. And just as an example here too, the one on the left here is a pit. Having that cap on there is kind of deceptive, but if you take the cap off, you can see that the well is finished down below grade. The pipe comes out the top and it goes to the home, whereas when you put a pitless unit on, that's what's down at 5 feet where it says threaded or welded coupling. Then you can extend your pipe to the surface and have your vent tube, and your wiring usually goes up there as well. So that protects you from any flooding issues, any heavy rainfall issues, and all those sorts of things. So it's just a better design. It's proper construction code in many states now, and that's the difference. And it gives the contractor, there's usually a cable that comes up to the surface that they can pull, then the whole thing pulls out with the pump, assuming you have the submersible. So how deep is deep? We get a lot of questions about what's a deep well, what's a shallow well. It's really subjective. It just depends on the situation. I asked 4 geologists today, this morning, and I got 4 different answers. If you're talking about an oil well that might be 2 miles deep versus, a drinking water well, whether it's unconfined, which is glacial material, and confined is bedrock, or not necessarily, unconfined means it's open to the surface, the atmospheric pressure. I'm confusing everybody here. Or confined means it's usually deeper, but not necessarily. You can't say if it's unconsolidated versus bedrock, because in a lot of places we have bedrock at the surface. It really depends. Like it says here, a pump manufacturer says a shallow pump is one it's a suction pump that can lift up to 25 feet, water level's 25 feet or less. But it comes back to like the diagram we showed of the bedrock well. There's only 30, 40 feet of casing. That well could be 400 feet deep or it could be 60 feet deep. What matters is where the water's coming in. And if there's a confining layer that protects water infiltrating from the surface from getting in the aquifer, I would say dug and bored wells are generally considered shallow wells, but you can also have sand and gravel wells that are fairly shallow. We have an area in Illinois where the aquifer is actually at the surface. It's sandy and it's 100 feet thick. So even if your well goes down to 100 feet and you have 4 feet of screen, that means the water's coming in from 96 to 100 feet below land surface. Even though that sand certainly provides some protection, it's a vulnerable aquifer because it's at the surface and gets a lot of surface infiltration. And so would you consider that shallow or deep? It's a subjective thing. And what matters is how protected it is and whether it's vulnerable to surface contaminants. And that's kind of a case-by-case type of thing. When asked to inspect a well for a real estate transaction, how often do I do that? Well, how do I do that? So we mentioned several things, and I mentioned that we have this assessment tool we've put together that's meant to provide a kind of a comprehensive look at whether a well's safe or not. Other states do things differently. Wisconsin has a form that if during a home transaction, if you want to have your well inspected, it has to be done by a licensed contractor, and you have to use their form. But the state doesn't want the form. They don't care to see it. They care that it gets done and provided to the buyer. And that's one way to do things. If you have a driller's log, it gives you a lot of good information about the geology, where if it's got a screen, how much casing it's got, how it was constructed, if it was grouted, all those things that tell you, it might look good at the surface. It may be a 6-inch or a 4-inch steel casing with a properly vented well cap. That says a lot, but it might only be 20 feet down, or it could be like we showed before, it could actually be a dug and bored well. You need to know those things to give a really good view. And in cases where you don't, you just have to use your best judgment. Look up other logs in the area, or talk to, if the state maintains logs, and see what the typical well constructed in that area is. Look at the geology. I would get somebody to help you if you need to, because if you need to understand where the water's coming from, which is based on the geology and the well construction, and also the site conditions. Is it in a low spot? You see a lot of areas where someone buys 5 acres and it's got a bluff that's above this little stream, and they build their house and they realize that up on the bluff there's no water. They have to go down by the stream and put a well in. Well, that well's prone to flooding every year if the stream floods, and if it's in an area that, that can happen. So you really need to understand those things, and there's a lot that goes into it. So, yeah, I would use our assessment tool as a guide. It's free and publicly available, and we can get you that information on where that's at as well. And that's what our training, our 4-hour webinar is on, how to use that, and that would be helpful as well, I think. Proper well disinfection, how, when, how often. There were a number of different questions from you all about disinfecting a well and what rules to use. So we had the luxury when we were developing this class of finding, literally probably, dozens, if not close to 100 different brochures, pamphlets, recommendations from different county and state agencies on how to disinfect your well. And the one that I settled on using is this one from the Minnesota Department of Health. I think it's 9 or 10 pages. It's well and water system disinfection. It takes you step by step through things, tells you to turn off your power, shows pictures, gives you a table on how to mix your chlorine so that you're not making it too strong. We get questions like, should I pour bleach down my well every spring? That's a bad idea. It's an oxidant. So a high level of chlorine can release metals in a bedrock well. It messes with the seals and ruins the rubber seals on your pitless, all those sorts of things. And so this is a step-by-step process, and to me, it's a really useful guide. And if you go on our website, the Private Well Class website, and look at those 10 lessons, the additional resources we provide, under Lesson 10, one of them is this, that you can click on this and download it from their website. So that's my recommendation. Also, you shouldn't disinfect your well unless you need to. And the only reason you would need to is if you notice something wrong and you test and you find out you've got bacteria in your well. The idea of disinfecting every year just as a good measure isn't a good idea for the reasons I just mentioned. And so what we tell people is you should only disinfect your well when it's necessary, when there's been a sample that shows you've got bacteria in your well. How do you recommend professionals respond when people ask why their water keeps coming back bad, or it's even getting higher bacteria levels? I'm going to assume in this case that every time they've had a bad sample, they've disinfected their well. And if there continues to be a positive hit, then what that means is they've got an active source of bacteria or coliform that has a pathway into the well. That could be livestock. It could be septic. I even think I mentioned here, it could even be a tree root that cracked the casing. But it means that either there's a well vulnerability or there's a source that's the water coming in the well, even if it's properly coming in the well, has an active source of bacteria. And if that happens, really the only thing you can do is try to find that source and remove it, fix the poor construction issue if there is one, or then lastly would be to add continuous disinfection. And that means adding a continuous chlorinator or UV, which, in some parts of the country where there's a lot of springs, there's a lot of those. And I didn't realize until we started doing this work a few years ago that there are home UV units if you're interested in that. Like in Tennessee, for instance, they've got a lot of springs that people use for their water supply, and so UV is fairly common and for private spring owners, I guess, in those areas. But it works for a well as well. Okay, so I said 5-minute break here, and then we'll go to questions. But I don't think we need to take a 5-minute break. We're up to 2:30 already, so I'm going to pull these questions over. Here's those. Let me make this a little bigger here. So, what are the sources of hydrogen sulfide in well water, and what are the solutions? Now, this was asked, and I didn't get to it to add it in, but I think Dan and maybe Walt Kelly might have an answer for you. Is that right, Dan, or am I speaking out of turn?
No, that's fair. I'm not the best source for this. Perhaps some of the people in the webinar actually have more experience directly with it. But what I've been told is a lot of times it's due to sulfur-reducing bacteria, and often people will chlorinate to get rid of it. Sometimes some health department people have said, oh, you might have to chlorinate a few times, like if there's a surface layer of bacteria. But I think it's usually attributed to some type of bacteria. As far as naturally occurring, if it's just always going to be in the water, I suppose if chlorinating doesn't solve it for a long term, you may have to add some continuous treatment. I've talked to some people who've had an aerator set up or continuous disinfection.
Yeah, we've got an aquifer in northern Illinois that's it's a bedrock aquifer that has that issue, and it's not bacteria. Yeah, it's my brother-in-law as well, and I tell you, I hate to take a shower there or drink the water, any of those things. So
yeah, it could be if you just have a continuous oxidant. If it's not just due to bacteria, then you would think that would oxidize it anyway.
Sure. Okay, so the next question, can you explain static level in a well? So the static is the non-pumping level. So that's the water level that, when you put a well in an aquifer, the water comes up in the well to a certain height, and that's the static water level when it's not pumping. And that level could be the same level as the water in the aquifer itself, or it could be higher. When a well is under pressure, it's considered to be artesian. So, for instance, we might have, let's say you put a well in an aquifer and the aquifer starts at 100 feet below land surface and goes for 100 feet. So the aquifer itself is between 100 and 200 feet below land surface. When you put a well into that aquifer, the water level could rise to maybe only 60 or 40 feet below land surface. Or in the case of a flowing well, it comes all the way out the top. And that's caused by pressure somewhere else in the aquifer. Water wants to be flat, so it's trying to reach a static level that makes it flat everywhere as far as the pressure goes. And because other areas of the aquifer may be higher in elevation, it's pushing water up into the well, kind of like you'd squeeze a juice box, to make water come out the straw or juice come out the straw. And so it's the natural level that aquifer, the water level, wants to be. And again, if it's unconfined, it's going to be the same level throughout the aquifer as far as it's going to have a free surface and that sort of thing. But if it's a confined aquifer, it could be under pressure where you put your well in, and the static level may rise up above the actual aquifer material. Hopefully that explains that. But really, it's static versus pumping, and a measure of how good of a well is or how much water it can pump is a measure of the difference between static and pumping water level and that sort of thing. Who would be the best and cheapest resource to get these tests done, and how can we be sure they use proper testing protocols to get valid test results? I'm going to answer first and we'll let Dan talk. As far as cheapest, I don't know, but what we recommend is that you use a state-certified lab. Every lab has to certify labs, every state certifies labs for community water supply testing. And legally, a community water supply or public water supply has to use an EPA-certified lab through their state program in order to meet compliance under the Safe Drinking Water Act. And to be safe, that's what we recommend nationally. Now, that said, there are a number of universities that have labs that used to be EPA certified, but because the requirements to remain certified have become so stringent, like I know our lab, which Dan runs, is no longer EPA certified, but they do follow all the EPA protocols. They use the EPA methods. They do everything that an EPA certified lab would do. We just don't have that little license number to say we do that. And that's not only here at the University of Illinois, but it's also at the University of Texas, or Texas A&M, Virginia Tech, and Penn State, where they have very active well owner outreach programs through their extension. They also have their own labs that do testing. I guess my point is I have to tell a well owner that I would recommend in any other state an EPA certified lab, but I have no qualms telling a well owner in those states to go to their university lab.
Yeah, that's a good answer, Steve. I have no qualms with that. I think we do good work here, but yeah, there are certain things that go into being certified that we just can't keep up with. It leads to significantly larger costs, so we wouldn't be the cheapest. And so often cheapest, it doesn't mean it has to be, the quality is bad. It's just there's certain other obligations. But one thing you can do is just ask what protocols they use. Ask if they run quality control. Ask if it's typical instrumentation that would be used in the EPA procedures, or if they use I don't want to knock the home test colorimetric kits because they can be very good, but it's different than an instrument. So if you are looking for a result that's from a lab that's from a typical instrument, I would say you should just ask them what they use.
Yeah, and you get what you pay for, and I understand, especially with private well owners, a lot of them, it's a barrier to even getting their well tested is the cost. I mean, I certainly understand that, but it's a valuable thing to do.
I think you mentioned before, Steve, that if you do everything, sometimes people will ask us, what about just everything on the safe drinking water list, or what about everything that can possibly be in the water? And it just gets into the thousands of dollars, I believe, I would guess.
This is Chuck. Something else where you could use the test strips is after you get your water tested, something like hardness or alkalinity, some things that would just stay the same, you can continue to test those, and if they're just staying the same, that will give you an indication that your water quality is good. If you should see a great change in your home test, then you can say, I better go get this tested again because something has changed.
Sure. All right. Number 4, I remove the livestock feeding from near my well. How long will it take for the nitrate levels to disappear from my water? Boy, I don't know if I have a good answer for that. It's just got to flush out of the system. Once that gets into the soil, it's like, I don't think it's the same as like arsenic near orchards, but, like I showed the Rhode Island example earlier, and, there hasn't been arsenic applied for 30 years or 40 years in some of those areas, but there's so much of it in the soil that it just percolates through as it rains and all that stuff. I think it really depends on how much there is. I don't know that I have a good answer. It could be a long time. And I know I'm not a nitrate chemist, but I know it also could be broken down. And I think it depends on, what the chemistry is and whether they're available to air and all that sort of thing. So
I think they say nitrate can move fairly quickly through soil, but we had a person once who insisted that she lived on a farm from her grandfather's farm, and she insisted that the nitrate was, that the livestock had been gone for decades, and she was getting something like 80 parts per million of nitrate as nitrogen, and it was just really high, and there must have been a local source is the only thing we could come up with.
So we're not really answering your question. I don't know that we would have a good idea on that, to be honest. Not something I've come across. So I'm sorry about that. Has there been any legislation developed with respect to requiring the destruction of abandoned wells prior to the installation of a new well on the same property? Not that I know of. Certainly not when putting in a new well. Now, in some areas where they put in rural water districts, like I know we have an area here in Illinois where it's karst geology, is very vulnerable. I know the health department in that county, about 80 to 90% of all the samples come back positive for bacteria, and so they've got federal funding to put in a rural water district, and in those cases they can require that the well be sealed, and we've certainly seen that because they're worried about cross-control contamination issues and those sorts of things as well. But I don't know of any legislation that would require someone putting in a new well to get rid of an abandoned well, and that's actually part of the problem. Matter of fact, one of the wells that I used as an example in our class on using this assessment tool, the old hand-dug well is still right next to the house, and the drilled well that they use is from the late 40s. So, the hand-dug well's been there even longer than that. Because there's no rules except for well construction, there aren't any rules related to abandoned wells. It's a problem, and I know I didn't answer the question, but we had a question about funding or what do we do about abandoned wells. In some states, the Soil and Water Conservation District will cost share abandoning wells, and in some areas, USDA provides low-interest loans through several of the RCAP regional offices for improvement or private well construction. And we can get you more information on that if you email us. There needs to be a lot of changes related to some of these issues. But as far as, like the woman who called me and wanted to see her state law changed because she has arsenic in her well and it wasn't tested for when they had their property transfer. In this state, it's an agricultural state. I told her for every person that wants to see the state come in and create a law that would make things safer for a private well owner, there's two people who don't want the government to mess with them and leave them alone. And so there's no political will to get those things done. In a few states out east, some things have happened, and actually on the West Coast too. Oregon has a law now that requires sampling at home transfer. In a lot of the country, you're not going to see that happen. It's just there's no political will for it. Just like in Pennsylvania, they can't even get a law passed to require well construction code or licensed drillers, which, is such a risk if someone isn't reputable. So generally, how much percentage of wells are used for agriculture irrigation purposes in the U.S.? Are they regulated by states or for water quality, or they need to be constructed based on state code? Well, in almost every state, they still have to meet construction code. And because they're considered a high-capacity well, in a lot of states they have more reporting requirements or they have other construction requirements that they have to meet. How many are there? I can just give you a couple examples. Nebraska is a very heavily irrigated state. I know a couple years ago they had 96,000 irrigation wells. In Illinois, we're not a heavily irrigated state. It's mostly in areas where along river bottoms. So it's along the Wabash, the Illinois, the Mississippi, a few of those rivers, larger rivers in Illinois. We have about 7,000 or 8,000 private wells, irrigation wells in the state. So in Illinois, we probably have, I would guess, we have logs for about 450,000 wells, and I would guess there's close to twice that many wells actually in use in Illinois. So when you consider we have 7,000 irrigation wells versus 900,000 private wells, it's not a big percentage, but they use a lot of water. We're talking some of these pump 1,500 gallons a minute versus a private well, which might in the end pump for a whole day on average, 2 gallons a minute or less. As far as are they regulated for water quality, I think that would be on a state-by-state basis, and I'm not, in Illinois they're not. We don't have near the same rules that you do out west for high-capacity wells and water rights. It goes back to there's either 3 or 4 different doctrines that regulate or that govern private or owning a well. Out west, I think it's called prior appropriation, prior something, where it's the first people who own land and had wells have first right to the water use. A lot of times private wells are exempt, but they're going away from that. In a state like Illinois, it's reasonable use. So unless you can prove that someone else's water use from their well has impacted you adversely, there's no legal standing, and your only recourse in Illinois, if you have a problem like that, is to take someone to court, which is a very expensive proposition. So it really depends. I know there's information out there. We actually even include it in our class. We talk about the 4 different types of doctrines that govern well rights around the country, but I don't know that offhand. I think that's all we have. Oh, yeah. Okay, so I appreciate everyone sticking around. I know we've went past our 90 minutes. And if anyone has any other questions, again, at the bottom of our webpage, it's privatewellclass.org, you can find our email address, and we will get back to you. And if anything else comes up, feel free. Let us know if you're interested in sharing our website on your webpage for your agency. That's certainly appreciated. All of these webinars, like this one today, are recorded, and they go up on our website. And so you can go there now and see like the lead webinar I mentioned or the septic webinar from July. They're all there, and including a webinar similar to this one that was done back in February. Okay, we have one more question. Anyway, but yeah, as far as all those things go, this will be up probably by early next week on our website. And so if you can go back through and look at some of the things you might have to write down if you're trying or that sort of thing. So do you know of any grant opportunities that municipalities can apply for with regard to well water testing? The only program that I know of that it's not at the community level, but you just need to check in your state. So like Iowa has a grants to counties program where a county can apply for funding through their state legislature for either subsidizing well testing or water testing costs or subsidizing well abandonment costs. That's the only state I know of that does that. New Mexico has a program through their septic program where they will give you a free water test if you register your septic system, because they do regulate those. And there's a lot of them out there that they don't. So there's, bits and pieces in different places. But as far as municipalities, I don't know. CDC has a Safe Watch program where they've funded a number of counties and states looking at trying to improve the way it's more of a program for bringing their program, to getting out there, the Safe Water program, and a holistic look at how to make a program that, does outreach and has education as well as provides sampling, the whole 9 yards. But those are fairly big grants. They're 5 years, and I know they've already funded, I believe, 19 states and 4 counties, and I don't know if they'll have another opportunity for that this next year or not. I think it all depends on funding, but I know with the 5-year grants, there's a number of states that are now working on that. And you might want to look at, I think you can look under Safe Watch or Safe Water under CDC and see if your state's participating. And if they are, maybe you can partner with them. I know with our assessments that we're doing around the country, the RCAP regions are doing around the country, we're certainly pushing the idea of working with other partners that may have some aspect already ongoing. So like I know in Tennessee, the Tennessee Department of Health is sampling springs as part of their CDC program. And so one of the RCAP staff that's in that region is actually going out with them and doing a well assessment for those well owners at the same time. And so, for the well owner, it's a win-win. Not only are you getting a free water sample, which the assessment that we're doing doesn't include, but then they're also getting someone who's looking at their spring and trying to give them advice on where their vulnerabilities might be and what the weaknesses might be and things like that. So again, we put out we have a webinar that's coming up that talks about how to partner with other groups. We've seen a lot of really inventive things, working with schools or working even with private businesses that might be interested in providing some funding for sampling, that sort of thing. That's all I can give you today anyway. All right. Well, it's 10 to 3 Central Time, and I appreciate everyone hanging around. And if you have any questions, let us know. And with that, I think we're going to end the webinar. Please follow up. Please join our partner page and participate. If you haven't taken the class and you're an EHP, we certainly recommend you take it on NEHA's website, and you can get 1 CE for each of the lessons versus taking it through our webpage where there's no quizzes and you get 1 lesson a week. The NEHA version you can do in your own time, but you can do it all at once basically. So does anyone else, Dan or Crystal or Katie or Chuck or anybody have anything else to add?
Not me.
All right.
No, I think you did a great job, Steve.
Yeah, it was a good seminar, Steve.
All right, thanks.
Yes.
And, Crystal, thanks for participating, and we certainly look forward to doing this more in the future. So.
Yeah, thank you for having me.
All right. Take care, everybody. Have a good day.